Hello friends, myself Dr. Sachin Marda, surgical oncologist and robotic surgeon from Yashoda Hospitals Hyderabad. February month is celebrated as Cancer Awareness Month. So let us have quick myths and facts about cancer, and let's have the best prevention strategies. Friends, now there is no need to fear and having anxiety about cancer, because now we have state-of-the-art technology. We have robotic systems for surgery, we are doing organ preservation surgeries, and there are good molecules which are available to treat cancer. For example, now conventional chemotherapy are there, but we have immunotherapy, we have a targeted therapy, we have a monoclonal antibodies, and we have a genetic therapies as well. And coming up to the radiation facility, those days are gone when there will be side effects of the conventional radiation, but now we have intensity modulated radiation therapies, IGRT, image guided radiation therapies, cyber knife, which will act in very precise way like a laser. So there the collateral damage, the complications rates are very less. And now because of the robotic surgeries, because of the laparoscopic surgeries, because of the organ preservation surgeries, now our patients can go home as early as possible. They can join their profession, their job as early as possible. The next important thing is about emotional wellness, because whenever we hear about cancer, patients can tend to go down, and to uplift their spirits, to infuse the positivity amongst them, we have the counselors, we have the psychoanalysts, and we have the support groups, where our own treated cancer patient, they discuss with their challenges, their issues, their do's and don'ts, which probably they would shy to speak with the doctors. So in a nutshell, now cancer is much very treatable condition. It would be like any other chronic condition like diabetes, hypertension. Now patients are living with cancer, even though the incidence is increasing, but the technology, the advancements also increasing. But prevention is the best way. So let us have a prevention check from our side. So first of all, have a healthy balanced diet, avoid junk foods and much of high calorie diet. Let us have a minimum 20 minutes physical activity every day. Let's burn our calories, oxidation process, and to prevent the lot of other benefits having cancer issues. Then let us have a regular checkup, like our normal health checkup. We have a cancer related checkup that is called as screening. For breast it is mammography, for uterus it is pap smear, and then we have a blood tests like serum prostate antigen for prostate cancer and ovarian cancer, CA125 and so forth. So let us have a check on regular period every yearly, probably maybe the birthday or marriage anniversary day. And let us have a vaccination like corona vaccination. Now we have cancer vaccines available. For example, human papilloma virus that can cause cervical cancer, we have a cervical cancer vaccine. Then for liver cancer, we have a hepatitis B vaccine. So let us be aware about, take knowledge, take the inputs from your physicians, from doctors, from oncologists, and practice it daily. Remember 7 danger symptoms of cancer: oral cavity, any non-healing ulcer or patch or bleeding from oral cavity, it could be oral cancer. Any breast lump after age of 40 or 50 could be breast cancer. Long non-nagging cough which is not coming under control in spite of 3 months, 4 months. Then irregular bowel habits, sometimes constipation, sometimes diarrhea, could be a intestinal cancer. Or the intermenstrual bleeding or abnormal bleeding or postmenopausal bleeding can be a uterine cancer. So these are, and bleeding from motion, bleeding for urine, these are all could be, I'm not saying are cancer signs, but could be a cancer sign. So friends, let's follow healthy lifestyles. Let's check our blood parameters and our healthy body in a check, and let us keep the cancer away. Thank you very much.